as of right now.
Oh, and then Helton. Okay. Like to call the House Health Committee to order. Will the clerk please take the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? Speaker Marsh, you recognize.
Thank you, Mr. Chairman. I have a young lady shadowing me today from Lincoln County, Michaela Erickson. Please stand, Michaela. Thank you.
Chairman Kumar, you recognize.
Thank you, Mr. Chairman. It's a pleasure to have medical students and physicians visiting us today. And I would call them Dr. Jessie Lee and her team. Will you please stand?
Representative Freeman, you're recognized.
Thank you, Chairman. And I would like to welcome a physician here today who is a constituent and also a neighbor and a friend, Dr. Mike Beckham.
Thank you. Any further personal orders? Today is TMA Day on the Hill, and we have some members from the TMA here, and as well as a couple of people that work at my hospital, Dr. Diana Cooper and Mary Jane Brown. Thank you guys. And I want you guys to particularly recognize Dr. Mary Jane Brown. It was, she knows what I'm going to say. It was 2016. I nearly died from having pulmonary emboli, and that woman saved my life. So thank you. All righty. So, yeah. So we have a pretty robust agenda today, and I have to go present a bill in another committee. So we're going to do a few things on the calendar, and then we've got some bills that we want to take up out of order. Item number 1, House Bill 2665 is going to be rolled to the heel. Item number 15, House Bill 2535 will be rolled 1 week. Item number 16, House Bill 2778 will be rolled 1 week. Item number 17, House Bill 2545 will be rolled 1 week. Item number 18, House Bill 2779 will be rolled 1 week. Without objection, we will take up item number 7, House Bill 2376 first. I'd given her that first. You have a motion and a second. And you have an amendment that makes the bill amendment 014951. Is that correct?
That's correct.
Okay, you have a motion and a second. Do you want us to go ahead and put that on the bill so you can explain?
Please.
Okay, without objection, we will be voting on amendment 014951. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. The bill as amended would require an annual reporting to the legislators of the data collected by the Department of Mental Health and Substance Abuse related to the use of medication-assisted treatment of opioid addiction. The opioid addiction problem in our state is and has been an epidemic for many citizens in our state. Its impact reaches far and wide and oftentimes deep into families. As the state is receiving more dollars through the opioid abatement funds and other grants, it is important that we as a General Assembly know how these dollars are being spent on medication-assisted treatment. We want to make sure that we know how these dollars are being used, what wraparound services these patients are receiving, and make sure that we are spending our dollars towards the most effective means of treating opioid addiction and not spending dollars on anything that is making the problem worse.
Do we have any questions for the sponsor of the bill? Okay, Representative Clemens, you recognized.
Thank you, Mr. Speaker. And could you give me an example of something that we'd be spending money on that would make the problem worse that you're looking to find?
You recognized.
Thank you, Mr. Chairman. We just know that sometimes that some of the other treatments are abused. They are narcotic and are being slipped into the prison. So we're just trying to make sure that we do the wraparound services and that we're using the right treatments.
Any further questions? Okay, seeing none, we are voting on House Bill 2376 as amended. All those in favor say aye. Aye. Opposed? Bill goes on to Calendar and Rules.
Thank you, Mr. Chairman. It's hard to be two places at one time,
Yeah,
isn't it?
go chair your committee. I got the same issue. Okay, that brings us to, I'm going to pull item number 9 without objection. House Bill 1999. You have a motion and a second. Chairman Jernigan, you're recognized.
Thank you, Chairman. I appreciate you taking me out of order. I have an amendment.
Okay, Amendment 014927.
That's it, sir.
Okay, you have a motion and a second. You're recognized.
Thank you, Chairman. The bill is amended directs the Tennessee Board of Pharmacy to promulgate rules that will ensure an individual who's visually impaired will have appropriate access to prescription labels, related materials appropriate to their needs. I'll be happy to answer any questions if you have any.
Okay, without objection, let's vote on that amendment. All those in favor say aye. Opposed? Ayes have it. Okay, do we have any questions for the sponsor of the bill as amended? Seeing none, we are voting on Bill 1999. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Government Operations.
Thank you, Chairman, members.
That brings us to item number 4. Chair Lady Hazelwood, House Bill 2213, you're recognized on your bill. And you have an amendment, I believe.
I do, Mr. Chairman, Amendment 013810.
Okay, you have a motion second on 013810. Would you like us to go and put that on the bill? Rewrites the bill?
Yeah, it does rewrite the bill.
Okay. Without objection, we are voting on Amendment 013810. All those in favor say aye. Opposed? Ayes have it. We are back on the bills amended. You're recognized.
Thank you, Mr. Chairman. This is a simple bill. It's would only establish a task force to look at an issue that ever since I've been in this legislature, we've been trying to deal with, and that is pay for the community agencies that provide care under contract with the state. These organizations don't get any kind of routine pay increases. Their costs continue to escalate, and it's very difficult for them to provide the services to Tennesseans that we expect them to do at the rates that we're willing, have henceforth been willing to pay. So this task force would just really look at a market study, look at what other states do, and determine what is a fair compensation rate for these folks so we can at least start working towards that. With that, I would entertain any questions.
Got a question on the bill? Any objection to the question? Seeing none, we are voting on House Bill 2213. All those in favor indicate by saying aye. Aye. All those opposed? All right. The bill goes on to Finance, Ways, and Means.
Thank you, Mr. Chairman. Thank you,
Thank you.
committee.
Yeah, good luck in finance. All right. This takes us to item number 2, House Bill 2801. Are you presenting? Okay. Representative Shell, I understand, is there an amendment on the bill? Have a motion and a second on the amendment. Do you have the drafting code
Yes, sir.
on that? What is that?
Mr. Chairman, it's 014228.
And that's what I've got. Let's go ahead and get this in shape. Motion and second on the amendment. Any questions of the sponsor on the amendment?
Question on the amendment.
All right. Any objection? We'll be voting on amendment 014228. All those in favor say aye. All those opposed? Okay, amendment 014228 goes on to House Bill 2801. Now on the bill as amended, any questions of the sponsor? Okay. With that, any closing remarks, sponsor? Or?
Move that be, you want me to describe the bill?
That would be good as amended.
Okay. The amendment on this 01428, this legislation will amend outdated language within the existing statute related to the vocational rehabilitation services the department provides, specifically the phrase rehabilitation centers is replaced with the community-based vocational rehabilitation services to ensure that the statute language aligns with the current delivery method utilized by the departments of vocational rehabilitation program.
Okay. Any questions on the bill as amended? If not, any objection to the question? Seeing none, all those in favor of House Bill 2801 indicate by saying aye. Aye. Opposed? No. Ayes have it. House Bill 2801 will be going to government up. Thank you. Takes us to item number 3 on the agenda, House Bill 2162. All right, we have a motion and a second. And then, as I understand, there's an amendment on the bill.
That's right, Chairman. There's a couple of amendments for the bill.
Okay, and I guess when we heard this before, we adopted Amendment 015048.
That's
Is
correct.
that
That is correct.
what you
and
want to go
we-
with?
We do have a couple of additional amendments.
Okay. What is the drafting code on the first one of those? You
On the first one, it's 16210.
16210. And have a motion and a second on Amendment 016210. Any questions on the amendment? If not, we'll go ahead and vote to put this amendment on the bill. If there's no objection to the question, all those in favor of 016210? Yes.
With this amendment, this strips out section 2, dealing with the sprinklers. This strips out section 2 that deals with the sprinklers. It removes that section. And that's all this particular amendment does.
Okay. Any other questions of the sponsor? Okay, any objection to the question on putting this amendment on the bill? Seeing none, all those in favor of Amendment 016210 indicate by saying aye. All those opposed? The ayes have it. The amendment goes on. And you have another amendment?
That's correct, Chairman. This one is 16272.
Okay.
And
Have a motion, a second. Would you like to describe?
yes, what this particular amendment does, where a facility has been placed on the registry, they can apply for the licensing at that point, and they would have 3 years from the time the license is issued to them. They would have 3 years to be fully sprinkled in the home. So that's what this particular amendment does.
Okay. And okay. And questions of the sponsor, Chairman Williams?
First of all, let me say the sponsor, Chairman, excellent job on this bill. A lot of work here over the last week from where the position we were last week. I like the last amendment because it dealt with an issue there. But the concern that I have with this amendment, and I don't know if you can answer this question, is who's liable between now and the 30-year anniversary of when they go onto this list? What I don't want to happen is if they do have an incident over the next, for instance, if you and I partner and we buy a facility and we put it on the list and a fire occurs at the 1 year point of us operating there of a 3-year rollout, who's responsible? Is the state at all accountable for that during that period of time because we made it permissible?
Representative.
I'm honestly not sure that I'm the one that can answer that question. My first thought was if I'm doing this type of business, I need to have insurance that would cover me on several different issues. That would be my first thought. But as far as the state's liability, they would have to be someone else answer that.
Okay.
Representative Clemens, you're recognized.
Thank you, Mr. Chairman. And my question was going to be in line with my friend from Putnam County about why are we bending over backwards to give these folks 3 years? If they're not in compliance, why are we adding in something in the law to give them 3 more years to become in compliance? And I don't know if that's something you can answer or not, but that's my concern. I don't know why we're bending over backwards for somebody who's not following the rules today.
Chairman.
Representative
What
Eldridge.
I guess my response to that is that, a lot of these places are out in very rural areas. They've even found one that didn't even have water in the house and it had like 12 people in it. I guess the ideal is to give them the opportunity to get in compliance. And we're going to have some bad players that's probably not going to do it. But a lot of these places are just out in a rural area, and I think it's to give time so that they can manage to get someone to come and do the sprinkler system. And I don't know if that's a good answer for you or not, but
Follow-up question,
Well,
Representative Clemens.
Thank you, Mr. Chairman. I certainly understand your perspective on that, but you can understand the concern that this would raise in Tennesseans' minds that if their elderly family member or loved one or disabled loved one is in a home that doesn't even have running water, we're now letting them go 3 more years to come into compliance and have, it's hard for any of us to go back to our district and say, well, these people have been taking your money, but they don't even have any running water. Now we're going to give them 3 more years. I don't understand why that is necessary. I mean, I understand. Let's go. Okay. I know that these houses are we're in need of these houses. These are valuable things that need to be provided. But if somebody's running one of these, taking money and is not even in compliance in that respect, I don't think they deserve the leniency of this body. And I don't know how we justify any leniency for somebody who's willing to do business like that. I know we need these facilities, but we should be incentivizing good actors, not bending over backwards for bad actors who we already know are bad actors. So that's my sincere concern with this, and I don't know, even if you shrunk it down to 6 months, I don't know that even makes it better in my mind, but that's my concern. Thank you, Mr. Sponsor.
Representative Eldridge,
thank you. And I appreciate your perspective on this too. But the whole point of this bill is to establish a registry. Right now, these places are popping up. When they get caught by, either someone turns them in or they have to go through like TBI to get them shut down or the fire marshal to shut them down. A lot of times they move. They'll go somewhere else and they'll start up another facility. And the whole point of this bill is to get a registry started so that we know who these people are and are they a bad actor? And if they don't comply, then they get shut down. I mean, that's it. It's the whole point. This bill, in my mind, has never been about sprinklers. I'd like to think it's the new improved, not a sprinkler bill. So the whole point of it is for a registry, so we know who these bad actors are. Right now, we don't know. I know of some in my county. I don't know what goes on in your county, but I know of one person that, every time she gets shut down, she just moves. She'll open up another house somewhere else, and it might be a year. And the last one, the one that I spoke on in the original, in last week, the only way that we found out about it was the coroner had to go to attend a death that had happened in that house. So, and there was no smoke detector, there was no fire extinguisher, and there was about 13 people in that house. So this is a step. This is a step. I think we go back and fix things all the time down here. So let's get a registry and we'll, see how it works out. But right now, we don't know who some of these people are. We don't know where they're at. But that's my point. This is, to me, is about tracking, being able to find out who is taking care of these people. So that's my perspective.
one more file.
Well, and I completely agree. Thank you for that last amendment, taking out that sprinkler. Brilliant move on your part. This part, and I agree with the registry. We got to register these folks. But that person who's closing down and moving around, now they can sit there for 3 years And then when you try to enforce this, if in 3 years, they're going to move again. So this doesn't address that. Even if you register them, if they're going to do that, now we're just giving them 3 years to do whatever they want, it seems to me. And that's the concern. So I appreciate you responding to it, but I just don't think we have to be that lenient to create a registry itself.
And
Thanks.
Representative.
My thought is when this registry is set up, their name is going to be on there. It doesn't matter if they move, that their name is going to be there. We might have to find them again, but at least we know who they are. And if they try to set up another one, they're on that registry, and hopefully we can deal with it from there.
Leader Gant, you're recognized.
Thank you, Chairman. I feel like what we're doing here is we're kicking this can down the road for 3 years. And my name's on this legislation. I support it. But are we addressing the real problem? No. And the whole reason why we were trying to put plumbers in this was to correct the problem. And the sprinkler contractors cannot be all over this state and put sprinklers in some of these applications. They will tell you that. And I want that on record today as we go forward, how we're going to address that issue. Thank you, Chairman.
Thank you. Drew,
Thank
Representative Eldridge to respond.
I'll take any more questions, but.
Okay. Representative Mitchell.
Yeah, thank you, Mr. Chairman. So my concern is the 3 years as well. So we know there's 106 or so, they said, out of compliance. My question is, how did they get a license in the first place? And now if we're going to give 3 years, that list shouldn't get any larger, but I'm kind of concerned that, you're doing the best you can by creating this registry list, but whoever's handing out these licenses within the state, I think that's our first issue we need to correct, because if they're handing out these licenses, knowing they're out of compliance from the get-go, there's our problem.
Representative Eldridge to respond.
Thank you. The whole point is they are not licensed. These are unlicensed homes. They are people that are taking folks into their house and keeping them. They are not licensed. This registry is the first step in them being identified, and then they can apply for the license. They have the opportunity to make the corrections that are needed and be licensed, but they are not licensed at this point.
Representative Mitchell, follow.
Well, then by no means do we need to give someone who knows they're breaking the law by running an illegal home 3 years to get in compliance. I appreciate you coming with the other amendment and correcting, that section too. But I mean, there's no way I could support giving somebody knowingly breaking the law. Let's give them 3 more years.
Response. Okay. Chairman Vaughn, you're recognized.
Thank you, Mr. Chairman. And to my next door neighbor on the rocking end of the 5th floor, I'm so glad you got this amended. Although I can't believe this bill wasn't double referred, and my colleagues in Commerce got a chance to look at it along the way. I'm trying to understand here, though. If we create this registry, the 3 years is for the bringing it into compliance from a fire safety issue, not necessarily from a health and hygiene standpoint from other regulatory amendments. This is strictly, the 3-year set aside is for the sprinkler compliance. So if you find a house with no running water, they don't get 3 years to fix that. At least if so, then there's a drawing board we need to go back to again. Mr. Chairman.
Representative Eldridge, you're
right. Then that you're correct. It does not apply to any other standards. It applies simply to the fact that they have 3 years to get the house fully sprinkled. That's the only thing that this amendment addresses.
Chairman Vaughn for a follow-up.
Yes, sir. Thank you. And pardon me I did not look on the dashboard, but does this mean that any home added to the registry from the day it's added to the registry gets a 3-year window to be in compliance with NFPA standards? Or if we add somebody, we have this 100 list of 100 folks. They're getting 3 years, but let's say number 109 comes in and gets on the registry. Are they given 3 years to come into compliance with NFPA standards, or are they required to be licensed and meet all the requirements the day that they show up?
Representative Eldridge.
If there is another one that comes on, they would have, I mean, it's from the time that they are identified when they go on that registry. And then they have the opportunity to bring everything in line, get into compliance with everything except the sprinkler system. They will have the 3 years. According to the amendment, they would have 3 years to do that.
And then
Follow up.
And thanks again, Bill sponsor. Trust me, you are trying to do something very good for a lot of people, and I don't want you to ever think that this body, while trying to work on this, doubts your sincerity and your attempt to right a wrong. Everybody's cool with that, and everybody respects you for that, and we appreciate you for that. As a matter of fact, it's something kind of, there ought to be a great deal of satisfaction we all get from keeping people from, frankly, being exploited because of the situation in life they find themselves in. And so from that standpoint, this is a very noble effort. But I tend to, if we found bad actors, then let's get up. Can we not do better than 3 years, I guess, is the issue. But don't we owe those people in those homes something sooner than 3 years? And I didn't know whether the 3 years was a negotiated settlement between interested parties, whether that was somewhat of an arbitrary number that was proposed, because I think you can see there's several of us that are having an issue. And that's the only issue.
All right.
That 3 year period is the only, because I really appreciate you bringing this back for us to have a look at. But I guess my question is, at this point in the day, are we married to the 3 years as being presented, or is there still some flexibility within that?
Representative Eldridge.
I honestly don't think I can answer that. This amendment was brought to me. I don't know where the 3 years came from. I think this has, you've got people, and I know we've talked a lot about the bad actors in this, but there are a lot of people out there that are trying to do their best by these people. They're taking them in. And I have been to a couple of the homes there in Morristown that were very clean. The people were well cared for, and this is affecting them just as well. And they will do whatever they need to do in order to make it right and be in compliance. But you've got the bad actors, and I think the whole point of the bill is to identify the bad actors. We have some. I'm sure we got them all across the state, but the whole point, and it's not to hurt them, per se. It's to help them get in compliance. And we even heard some testimony from some of the sprinkler people that they would work to help get these people in compliance. We also heard how long it takes to get a sink fixed at your house this morning in Senate, where took 5 months to get a plumber to the house. So I think the 3 years, I don't know exactly where it came from. I can't speak to that, but there are people out there that are doing the right thing, or trying to do the right thing. And there has just not been any guidance whatsoever up until this point. This is hopefully to give them some guidance.
Okay. Representative Freeman.
Thank you, Chairman. And I'd like to echo my the legislator from West Tennessee and thank you for this, because it is important. And I just want to make sure, and I'm going to ask a couple of questions, but is Amendment 2, did it go through the Senate version as well?
No, sir.
Here's my fear. Well, here's my fear, is that it's not a sprinkler bill, comes back as a sprinkler bill, when we have two versions of the same bill coming through the House and the Senate. And would you be willing to remove Amendment 2 and get it in the same posture as the Senate? And let's move this down the road.
If I could interject here, staff and legal has told me what we put on as Amendment 2 today, I mean, the second amendment we've done 016210, as I understand again from staff, that did go on as an amendment on the Senate side.
The
verbal amendment on the Senate side.
Then Amendment 3, then, I'm sorry, maybe I'm.
Okay, the 016272 that we're discussing now?
Yes.
Okay.
I meant to say the Second Amendment, not, and I guess it's really the Third Amendment.
Okay.
So did Amendment 3 go on in the Senate then?
Apparently not. The one we are discussing now, as I understand from staff, did not go on the Senate side.
I'm going to say it again. My fear is not a sprinkler bill is going to become a sprinkler bill again. We're going to have two alternate versions of a bill running through the process. And, we're going to end up with it back on. And I mean, is there any willingness for you to remove Amendment 3 and let's get down the road with this?
Representative
I'm not
Evans to
sure where
respond.
we're headed to from this committee at this point.
Government operations.
Okay. I'm open to, I mean, if we can, I'd like to move it through this committee. And I'd be glad to work with the people that are involved to see, what they think.
So is that a yes?
Yeah.
Okay.
Now to make sure I know, I think you asked if you would be willing to move this amendment to the table. In other words, not pursue it. I got the feeling you're wanting to put it on and move it forward the way you want it.
I'd like to
But
move
let
it.
me interject myself a little bit more. Generally, I think in most committees, we
to
like to try and
Representative
get
Freeman.
things in the best shape we can before moving on to another. But am I correct? Were you two misunderstanding on different tracks there?
Chairman, you were very wise. That's exactly what was happening. I guess I'm just going to make a motion.
And I have to interject myself again. Could you maybe send that to my wife and 5 daughters sometime? I'd like them to hear that.
I'll happily do that. So, Chairman, I guess I'd like to make a motion to table Amendment 3.
Oh, good. Perfect timing to hand the gavel. if you want, you can have a minute to catch up while we. Well, staff says you don't get a minute to catch up. I will say this, will you restate your motion just so we're all up to speed?
Yeah. I think it actually, I'll retract that. We're going to vote on this in a second. So I would just encourage everyone to vote against Amendment 3 and let's get it in the same posture as it is in the Senate. And let's start doing what he's explained the intent is, what we've thanked him for the intent of this legislation, and stop muddying the waters with making it a sprinkler bill.
You're recognized.
Just one comment. I was informed that when nursing homes were required to put in sprinkler systems, they did have a 3-year window to do so. I don't know that makes any difference. My position right now would be that we move the bill forward as it is.
So as it is without this amendment,
Pardon?
as it is without the amendment,
With the amendment.
but without the second amendment. Am I third? Oh my gosh, y'all have lost me here. Without the third amendment, the latest amendment.
I think that I think it's an important part. I mean, I know 3 years, we've got concerns there, but I mean, if we gave nursing homes 3 years to be in compliance, I think it's important that these homes have sprinkler systems. And if we don't, I mean, if we remove it, then they're not going to do anything if we remove that. So I would prefer that it stay in.
Chairman Williams, you recognized.
Thank you. Chairman, I know we've got a motion on, in a second to table this. I know that this is was that motion withdrawn? Okay, so Chairman, we all respect and love Chairman Eldridge. I think it'd probably be in order to make sure that we got this sorted out, that we get a little more research done because your committee's not closing today. Could we not roll this another week, give him a moment to work on it and then come back? I know we said that last week, but what is the chairman's posture as it relates to timing?
I mean, we will be here next week, but I'd have the sponsor of the bill.
I'm fine if that's the will of the committee.
Then Chairman, I make a motion to roll this bill 1 week.
That's a proper motion, properly seconded. Is there any objection? All right. All right. Without objection, House Bill 2162. All right. Without objection, we will roll House Bill 2162 1 week.
Thank you, Chairman and committee.
Chairman, just to make sure we know where we are going forward, that bill, we put on the first newly filed amendment. The second one, when we come back, we'll be in the posture of a motion and second on the second amendment, the 3-year rule.
Right.
Okay.
Okay. Never mind. Okay, what number went? All right, that brings us to item number 5, House Bill 2335. Chairman Vaughn, you're recognized. You have a motion, second.
Thank you, Mr. Chairman. House Bill 2335 contemplates making some adjustments in the regulatory structure for OBOTs. And if you're not familiar with an OBOT, that's a term for an office-based opioid treatment facility. These facilities have a medical director. They've got to follow rules and regulations from the Tennessee Department of Mental Health and Substance Abuse. We've also got patients who go to these facilities. They're seen face-to-face and physical exam is performed. They also counseling, case management, and medication management activities and drug screens are performed there. We dealt with this industry about 2 years ago when we allowed for nurse practitioners and physician's assistants to be able to assist the physician in the office setting. And at that time, not only did we do away with, or we allowed the physician's assistant and nurse practitioners to participate, and they were allowed to write up to 100 prescriptions in consultation with the physician. But we also did some things that added more structure to prevent abuse in this setting, such as not allow cash payments into the treatment center. We thought that would be an element that would help diminish abuse within this industry, because we know that this industry does have some, it's a growing problem, particularly opioid overdoses and fentanyl-related deaths. We've seen them rising 70% in the last year throughout Tennessee. So this bill, House Bill 2335, it proposes to do primarily a couple of different things. One is it aligns our state laws with federal laws. It regulates the use of telemedicine for utilizing buprenorphine to ensure that patients are receiving the necessary full wraparound treatments and not just calling in with a FaceTime call and being able to get a prescription. And then the setting for this is in the non-residential OBOTs that I described earlier. So anyway, this bill functionally would allow the physician's assistant or the nurse practitioner to be able to write up to 250 prescriptions as opposed to 100 that we had kind of taken on as a pilot project. And in addition to that, we're removing the ability to practice telemedicine within this setting. And that's the bill.
We have an amendment. I think you described the amendment. Are we going with amendment 015936? All right. So without objection, let's vote on amendment 015936. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. Do we have any questions for the sponsor of the bill? Representative Clemens, you recognize.
Thank you, Mr. Chairman, and I'm proud to co-sponsor this legislation with my friend. My question about this last amendment is, just for the record, are we limiting the ability for people who suffer from chronic pain or any of those types of things to be able to access these prescriptions, or placing any more hurdles in their way?
You recognize.
No, sir. I think that what we've got is a balance between protecting against abuse and still providing access to people who have a needs for these medicine.
Representative Hicks, you recognize.
Thank you, Mr. Chairman. And I have full respect for my hallmate, rocking hallmate down the hall. We have a great fifth floor end of the hall. So, but Northeast Tennessee is where I'm from, and we just seem to have a real issue here with what's been going on, especially with Suboxone clinics in our area. You take our area has about, in Sullivan and Washington County, we have about 280,000 people in those two districts. And we have 129 prescribing doctors and 28 clinics in our small area. Just to give you a little something to think about, Shelby County, I mean, they've got probably around 1 million people, close to it. They have 81 is how many they have. Davidson County has really stepped up their game on Suboxone clinics. They have 241 now. So, I am not a person that is against MAT treatment and Suboxone clinics. I just don't want to see this get out of hand, just like the opioid epidemic did. We did have a real opioid problem across this state. And it was an overwhelming thing, and we needed some kind of treatment at that time. And I think this MAT treatment, fully answered the call. It's just that now and moving forward, we really have to watch it. The Department of Mental Health and Substance Abuse has done a real good job. They've turned the tide. Now, meth is the problem in Northeast Tennessee. 80% of the drugs confiscated now in Northeast Tennessee is meth. Meth in our area has passed marijuana in the most drugs confiscated, and actually Suboxone sold illegally is not far behind. Telehealth has been a big issue, especially since 2020, since COVID hit. There's not been, over the last year or two, hardly any drug testing or any counseling in this field, unless it's just a really good OBOT that tries to do a good job. But those are few and far between in our area. It's a very lucrative business. If this goes to 250 patients times about $125 per visit, that's about $31,000 per week and $1.5 million a year for one doctor. So I would call that pretty lucrative, and to try to stay in business. And when meth is the biggest problem in Northeast Tennessee, I can't figure out where all this is coming from. These are the same, I believe it's the same drug companies that we trusted, and they created the opioid epidemic. So it's very confusing to me. And one of the bad parts about this is the NAS babies, the neonatal abstinence syndrome. As prescriptions goes up, so does that go up as well. Sullivan County, our next door neighbor, has the highest rate of NAS babies being born at 30.5 per thousand. East Tennessee has just the rest of East Tennessee has about 16.4 per thousand. And just to give you another number to enlighten you a little bit, Davison County has 1.6 and Shelby County has 6.6. And out of these NAS babies, this is all on state website, 80% is from MAT treatment. 80%. 60% of it is from prescriptions, and 20% is from diversion. So when we talk about, I'm in education, when we talk about struggling kids, this is where a big part of this comes from. And during all of this, we had 3,200 overdose deaths last year in Tennessee, up 45%. Sullivan County has 1.2 deaths per week right now from overdose. It's the number one drug being brought into our prisons illegally. And we contacted within the last 2 days 9 of these OBOTs. 4 are cash only. 2 take insurance, but they have a cash option. So, I'm just very concerned. I just want to educate people the best I can as you vote on this kind of stuff as it comes up, because it's going to keep coming up. And I just want to try to educate folks to make a good decision, because this can turn into a real mess, and it is in East Tennessee right now. So thank you, Chairman. Thank you for your indulgence, committee. Thanks.
Thank you, Chairman Vaughn. You recognize.
Well, I appreciate my neighbors, the fifth floor neighbor guy I respect tremendously, and not just as a colleague, but as a man himself. His passion for this is understandable. I know that particularly when things affect your district in a certain way, that you're not liking the tide and you're not liking the way that the trends are going. I can understand your passion on it. I would say that with regards to how this is, we know that we have a drug abuse problem throughout our state. The statistics prove that. My thoughts are is that this will help, when administered correctly, will be an assistance with that problem. I'm certainly not proposing that we increase the problem by this legislation. That's not the intent at all. His warnings about being judicious in our thought process of what is actually helping and what is actually hurting is something that we all have. Frankly, I'm not. I have to rely on the testimony of people who I trust and I know. And I know that we can see even in the variation in statistics of what affects different areas that we have different levels of concern about different issues, that some are not even contemplated with this bill. But other issues in certain parts of the state run hotter than others. And so I would be willing to work with my colleague to work towards getting something that would address those. I don't know. I guess my question is, with regards to this bill that we've got in front of us today, I know it could help a lot of people. I certainly wouldn't propose a bill that I knew would harm people. And my question then goes to, if we leave things status quo, is that a step forward? Because I think what we really need to do is make a step forward with the issues that my colleague has. But I would just tell everyone, vote your conscience. This bill could help people, and I'll leave it at that.
Thank you, Chairman Kumar.
Thank you, Mr. Chairman. I want to thank the sponsor of this bill. I think it's a good bill and it moves things in the right direction. I also want to thank Representative Darby for, I'm sorry, it's Representative Hicks. I apologize, for your analysis. I'll have to apologize to somebody else also. But really, thank you. Thank you. You have gone through the matter. You're familiar with the matter, and I value your input. I would like to add certainly that after the Tennessee Together program, where we cut down the opioid prescription dispersion and so forth, we did make significant inroads, and we did certainly achieve decrease in prescription opioids as much as 60%. But the amount on the street, the number of overdoses and deaths still have continued to increase. And I think that's where the problem is, that illicit stuff that gets on the street. And with NAS, we had made headway. There was one time things were at a plateau, but I see that now that's on the increase too. And I think, again, the problem there lies on the street illicit drug side and not prescription alone. That is still a small part of the problem. Regarding this bill, I think it increases availability of medication-assisted therapy for addiction, which is good. It makes it more convenient, and buprenorphine and these drugs are safe. The only thing with them is that once people get on them, it's a lifelong thing. And the expense of it is tremendous. But we don't have another alternative. We can't let them stay on drugs they're addicted to. But are we switch? Yes, we are switching that addiction to buprenorphine and these drugs. And it is better. It gets people more functional. They are able to live a fairly normal life, but the number of people that are able to use this therapy and then be drug-free is relatively very, very small. But still, it is the best thing we've got at this time, and we should support it. Thank you, Mr. Chairman.
All right, thank you. Any further questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 2335. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. If you wish to be recorded as a no, please notify the clerk. All right, that brings us to item number 6, House Bill 2705. Representative Carringer, you're recognized. You have a motion and a second. And there is an amendment 016175. Is that correct?
That's correct, Chairman.
Okay. Okay. You have a motion and a second on that. Any objection to us putting that on the bill? You good with that?
I'm great with
Okay.
that.
Without objection, we'll be voting on Amendment 016175. All those in favor say aye. Opposed? Ayes have it. Okay. We are back on the bills amended. You are recognized.
Thank you, Mr. Chairman, and thank you to all the wonderful members on this committee. Can I have just a point of privilege real quick, Chairman?
Absolutely.
I just wanted to introduce, since I'm not in committee right now and she's going to be leaving, I wanted to introduce my shadow for the day, Edna Erickson. She's from Lincoln County, and she is with the Eagle Forum today, shadowing me. So very, very impressed with this young lady, and I'm looking forward to seeing what her future holds. So thank you. So I just want to begin. I don't know if I hope it's going to help me and not hurt me, but I'm a part of that rocking hall up there on the fifth floor also. So I hope that does not hurt me. So anyway, okay, I bring House Bill 2705, which was brought to me by the Musicians for Smoke-Free Tennessee. And what it simply does is to allow municipalities in Tennessee to create smoke-free ordinances for age-restricted venues, which would be music venues and bars. If there is no strong demand in a city, or if there is a strong demand for it, they can now explore with an ordinance. If there is no demand locally, then nothing would change. A local option would also help aid tobacco vapor prevention efforts. Smoking and vapor in bars normalizes the activity, and creating a climate for youth participation to flourish. Youth vaping, as probably most of y'all know, is an epidemic in the state of Tennessee, as well as probably most all the other places. Musicians and hospitality workers are essentially the only group of Tennesseans that do not have a guarantee of a smoke-free workplace. That is due to the remaining exemption and Non-Smokers Protection Act that was in 2008. as we said, we just voted on the amendment, which also includes the tobacco stores, retail vapor product stores, as well as the cigar bars. So with that, I'm here for any questions.
Representative or Chairman Williams, you're recognized.
Thank you, Representative Carringer. Thank you for this bill. I actually had to give up 2 fingers to pass a bill several years ago to allow my local community to prohibit smoking in an outdoor amphitheater. And so this is a great opportunity to let locals control what's going on locally as it relates to smoking. So I really appreciate you bringing the bill.
You're recognized.
And just to make a comment to that, I served on Knox County Commission, and I was even on commission when we allowed our Knox County parks to prohibit smoking on playgrounds and all outside. So thank you very much for that.
You had 2 people on the list potentially to testify. Would they like to testify? Or
I
not
do
necessary?
have the musicians for Smoke Free Tennessee, and that's up to them. If anybody on the committee would like to hear from them, or we're fine either
Yeah.
way.
Okay, without objection, let's go out of session. Let's hear from Jamie Kent. He does. Huh? Yeah. Just for the record, you state your name, who you're with, and you got 3 minutes.
All right. My name is Jamie Kent. I'm chair of Musicians for Smoke Free Tennessee. Thank you so much to the chairman and members of the health committee. I have been a working class artist for the better part of a decade. I've played 1,000 shows throughout the country, and I've battled asthma my whole career. So this is why this is so important to me. I've shown up in venues and not realized there was going to be smoking, and lost my voice halfway through a show and had to cancel the next couple of dates because of it, losing income, being embarrassed in front of fans, and really not wanting to choose between my livelihood and my health. And there are countless other stories in our coalition of artists in similar places with burned eyes, smoke in their hair, merchandise that smells like smoke for weeks afterwards. It goes on, and it's an honor to be able to advocate for our artist community. We are proud to be one of the treasures of Tennessee, and we would just like the same protection for our workplaces that every other Tennessean gets as well. Or in this case, just the ability to organize locally and try to change that where there are a lot of musicians, because we know that, and we feel like this bill is a perfect compromise in that way, because there are places where there are a lot of musicians and a lot of demand, and this gives us that opportunity. And in more places where there aren't as many or aren't as much demand, this creates up for nothing to change there. It's really easy to just step outside and smoke and then come back in and enjoy the music that way. So this has never been about not smoking. It's just not smoking where we work. So I thank you so much for your time and the opportunity to speak here. And I welcome any questions you might have.
All right. Any questions for Mr. Kent? Okay. I actually, although no questions, I do have a comment, and actually I want to commend you. From self-governance is something that's big with me, and you being an advocate for what you believe in, I think is admirable. And appreciate what you've done. You and I, we've had multiple discussions on this, and I do have some issues a little bit with the policy of it, but I don't know how else we get there. And I'm an asthmatic, and I'm going to a show tonight, and it's going to be smoke free. But that being said, I just wanted to commend you.
Thank you.
Okay. Seeing no further questions, okay, we are back in session. We are back on the bill as amended. I just, before we vote on this bill, again, the policy issue, I don't know how else we get there. I've looked at it from a TOSHA standpoint, statewide. Just in the event that we end up with some hodgepodge, I'd like us to be able to come back in the future and, if this needs to be statewide, work on that. And I just like that commitment.
And you can have that commitment for me. Chairman Terry and I both have asthma and very much know how difficult it is. And so that's why I was very interested when they brought this bill to me, because it is hard, and they are the only ones that don't have any kind of protection right now. So I promise if there's a way we can get that rolling, that I will bring that back.
All right, thank you. All right, without objection, we're voting on House Bill 2705. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman. Thank you, committee.
All right, we've already taken care of item number 7. Item number 8, Senate Joint Resolution 202. Chairman Helton, you recognize?
Thank you, Mr. Chairman. SJR 0202 encourages health insurers, providers, and hospitals to adopt the CDC hepatitis C screening guidelines to test all pregnant women in Tennessee for hepatitis C to help prevent the spread of new infections.
Any questions for the sponsor of the resolution? Okay, seeing none, we're voting on Senate Joint Resolution 0202. All those in favor say aye. Opposed? Ayes have it. Bill goes on to, or resolution goes on to calendar and rules. Okay, we've already voted on item number 9. That brings us to item number 10, House Bill 2565. Representative Keem, you're recognized.
Thank you, Mr. Chairman. I believe we do have an amendment.
Let's get this in proper motion. Do we have a motion on the bill? You have a motion second on the bill. We have an amendment. The amendment is drafting code 014708. Is that correct?
Correct, sir.
Okay, I need a motion. You have a motion and a second? Okay, that rewrites the bill. Would you like us to go ahead and put that on the bill?
Please.
Okay, without objection, we're voting on amendment 014708. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. During the pandemic, our Department of Health did an outstanding job operating under a federal waiver, precluding the state from requiring a physical presence for applicants for assistance. During the pandemic, that changed the way we conducted business to keep serving the citizens of our state, and our department did an outstanding job. Waivers like the one we put in place during the pandemic allowed for many Tennessee families to be served over the phone or remotely. And so with this bill, Mr. Chairman, we're requiring the department to essentially do a study on remote access for our constituents. And similar to that took place in 2020, 21, and 22, requiring DOH to conduct a review of the services that we provide. With that, sir, we'll attempt to answer any questions.
Any questions for the sponsor of the bill? Okay, seeing none, I would like to commend the sponsor of the bill for working with the Department of Health on this, and there are issues at the federal level that they need to address, but I do appreciate your work on this.
Thank you.
So without objection, we'll be voting on House Bill 2565. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 11, House Bill 0686 by Representative Beck. You are recognized. You have a motion second.
Thank you, Mr. Chairman. I do have an amendment, which just changes the enactment date 015087.
Okay. You have a motion second on the amendment. Would you like to go ahead and attach that? Without
Yes.
objection? Okay, without objection, let's vote on amendment 015087. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman and committee. I'd like to read into the record, this bill was brought to me by a constituent, and she couldn't be here today, Miss Nancy Harvey. But she gave me words that she would like for the committee to hear. I've been severely allergic to peanuts my entire life. My doctor has advised me to keep dual EpiPens with me at all times because of the severity of my allergy. Despite due diligence, I have inadvertently come into contact with peanuts or peanuts products and get an allergic reaction. I've been instructed to use the pen immediately when I get the reaction if it does not work in 15 minutes. I have been instructed to use the second pen due to severity of my reaction.
In an instance where this happens over a weekend, I'm out of refills and unable to get more EpiPens. I have to rely solely on ambulances or getting the ER to treat my reaction. If this bill passes, I would be able to go to the pharmacy and get an EpiPen to protect me until my doctor's office is open and able to write a prescription. If Narcan can be free and available to anyone who asks, then an EpiPen, I should be able to get one on weekends and holidays. Ladies and gentlemen, some of us have this allergic reaction. I know when I was in the military and we had chemical warfare training, they always gave us an EpiPen. And if we were exposed to the chemical warfare, we would have to self-administer this EpiPen. EpiPens are life-saving. All we're asking here is if you've got a previous prescription for an EpiPen and during the weekend or during a holiday, that you'll be able to go to the pharmacy and the pharmacist will be able to allow you to have a EpiPen even if your prescription is out. With that, I stand ready for questions, Mr. Chairman.
All right, thank you. Any questions? Representative Clemens, you're recognized.
Thank you, Mr. Chairman, and thank you, sponsor, for this legislation. As the father of a child who can't leave the house without an EpiPen, this is vitally important, and I'm sure I'm not the only one sitting up here in this situation or watching this committee, so I appreciate your work on this. This is very important and will come in handy and help improve the quality of life of those who rely on EpiPens. Thank you.
Thank you.
All right, thank you. Chairman Woodson, you're recognized.
Yes, I just want to echo my friend from Davidson County. Thank you for bringing this. I think this is great legislation and much needed. And I just want to say, if you ever saw a demonstration of an auto ping injector for a nerve agent, you would really decide whether you want to stick yourself on one of those or take the chance. But no, this is great. Thank you, Representative Beck.
Thank you, Colonel.
All right. Thank you. All righty. Yeah. Great idea. Good bill. So without the objection, seeing no further questions, we'll be voting on House Bill 0686. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman and committee.
Thank you. All right, that brings us to item number 12, House Bill 2207. Representative Hicks, you're recognized. You have a motion and a second, and there is an amendment.
Yes, thank you, Mr. Chairman.
013779.
That's it.
You have a motion and a second. You are recognized.
I've been working with.
Would you like to put that on the bill first?
Yeah, sure.
Okay, all right. Without objection, let's vote on amendment 013779. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bills amended. You're recognized.
I've been working with a psychologist association on this bill. Once a prospective psychologist has finished their 4 years of PhD classwork, they must complete a 1-year postdoctoral training under the supervision of a licensed psychologist and are granted a 1-year provisional license while engaged in such. If an individual does not take and pass the national exam and jurisprudence exam during this postdoctoral year, then they can obtain a temporary supervised license for a maximum of 1 year after they finish their postdoc requirement. This bill, as amended, would allow a candidate who fails the national exam to take the exam a second time while they have a temporary license. It would not extend the 1 year they can have a temporary license. This bill would also allow 30 days after the second failure for both the provisional and the temporary licenses for the licensee and supervisor to transfer the care of the patients they are seeing before their license is revoked. It's brought to my understanding that there's only maybe about 2% of the folks that don't pass the test, but At this point where we're at and with the situation we're in after COVID and such, we really need those 2%. And one of the biggest parts of this bill is the fact of transferring the care if they don't pass the test. That is one of the biggest parts of the bill. So with that, I'll be happy to.
Okay. Any questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 2207. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right, that brings us to item number 13, House Bill 2500. Chairman Boyd, you're recognized. You have a motion, a second, and there's an amendment that rewrites the bill. Is that correct?
That's right, Mr. Chairman. I'm showing drafting code 014217.
014217. You have a motion, a second. You want us to go ahead and put that on there?
Yes, sir. That'd be great.
Without objection, we're voting on amendment 014217. All those in favor say aye.
Aye.
Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. House Bill 2500 would transfer the Board of Licensing Healthcare Facilities from the Department of Health to Health Services and Development Agency, which would be renamed the Health Facilities Commission. Mr. Chairman, I'll take any questions.
Okay. Do we have any questions for the sponsor of the bill? Oh, what's wrong? Okay. Representative Clemens, you're recognized.
Thank you, Mr. Chairman. This bill's 46 pages long, and it just renames the. I mean, what else does it do?
You're recognized.
Thank you, Mr. Chairman. No, that's all it does. It just transfers the Board of Licensing for healthcare facilities over to HSDA, and they renamed that. There's a report that's going to be generated next year to the General Assembly about what it would look like to integrate certificate of need into to one governing body. That's still coming next year. This is just something that needed to be done sort of in the time being, Mr. Chairman.
Representative Clemens. Good. Okay. All right. Any further questions for the sponsor of the bill? All right. Seeing none, we are voting on House Bill 2500. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules. All right. That brings us to item number 14, House Bill 2649. Chairman Williams, you're recognized.
Thank you, Chairman and members. House Bill 2649.
Need a motion? You have a motion second?
Thank you. House Bill 2649 was brought to me by Chairman Watson in the Senate regarding Erlanger Hospital. This bill is brought about mainly because Erlanger is having issues facing this shortage of qualified law enforcement officers at their facilities. And they've submitted a letter back in January requesting some assistance for a statute change similar to North and South Carolina's. As this bill introduced, this will allow private guards to comply with peace officer training standards. They must be designated a special deputy by the local law enforcement agency, and that local law enforcement agency will define the jurisdiction of the private guard in which they can serve. With that, Mr. Chairman, I'm happy to answer any questions.
Okay. Any questions for the sponsor of the bill? Okay. Seeing none, we are voting on House Bill 2649. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right. We have taken care of items 15, 16, 17, and 18. That brings us to item number 19, House Bill 2849. Chairman Kumar, you are recognized. You have a motion and a second. There's an amendment, I believe, on this amendment drafting code 013746. Is that correct?
That is correct.
Okay. You have a motion and a second. It rewrites the bill. Would you like us to get that on the bill?
Yes, please.
Okay, without objection, we'll be voting on amendment 013746. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. The amended bill allows the Board of Medical Examiners to issue an eligible physician or medical graduate from a foreign country or foreign territory a short-term visitor clinical training license for 90 days. And before doing this, it is verified that they have a medical degree from a recognized institution. They have proof of written acceptance into a professional program in medicine, and they have lawfully entered the United States. These credentials are verified, and United States is certainly a leader in providing education and scientific know-how for other countries, and I think this facilitates that. Again, it's a short-term 90-day license for those who are here for training purposes. With that, Mr. Chairman, I'll renew my motion.
Okay. Any questions for the sponsor of the bill? Okay. Seeing none, we'll be voting on House Bill 2849 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations. Right, that brings us to item number 20, which is House Bill 2559, which is my bill. I will pass the gavel to Chairman Ramsey.
Dr. Terry, you're recognized on House Bill 2849. Oh, pardon me. Have a proper motion and second on the bill. That's 2559.
Yes.
Motion.
Thank you.
Have proper motion and second on the bill. You have an amendment, sir?
Yes, there's amendment drafting code 014257.
Motion and second on the amendment. We'll go ahead and put the amendment on the bill. All those in favor of the amendment as stated, say aye.
Aye.
Any opposition? We're back on the bill as amended. You're recognized, Dr. Terry.
All right, thank you, Chairman Committee. Under current law, a child may be placed in a drop-in child care center for a maximum of 7 hours per day and 14 hours during a regular weekday business hours and 20 hours maximum per week. This bill would simply increase the maximum daily hours to 9 and maximum weekday business hours limit to 18 to accommodate the average workday of 8 hours and a short commute both ways. With that, I'll be happy to take any questions.
Do I see any questions or comments on the bill as amended?
Question on the bill.
Question been called for. There are no objections. We will be moving this bill to calendar and rules. All those in favor say aye.
Aye.
Any opposition? So approved.
We've got one more bill.
Dr. Terry, you're recognized on another bill.
Yeah. House Bill 2665.
Motion.
Have proper motion and second on the bill. Do you have any amendments on the bill?
Yes, amendment 016300.
Motion.
Stand for, have a proper motion and second on the amendment. Does this amendment make the bill?
Yes, it does.
And we have several others.
This one does make the bill.
Okay. We have a proper motion and second on the amendment. Any question, we'll be voting on the amendment to add to the bill. All those in favor of the amendment say aye.
Aye.
Any opposition? So approved. We're back on the bill as amended. You're recognized, Dr. Terry.
All right, thank you. And section 1 of the bill, some of the facilities that are specifically listed should fall under current statute, but we wanted to make sure that there was clarity to cover those facilities, including the congregate living facility. And section 2, the intent of the omnibus bill was to address visitations pertaining to critical and terminal COVID patients. And so section 2 clarifies this section of the code. And there is an untimely filed amendment that from the Speaker's office that I would have to get a motion a second to consider, and it just adds in the language visitor during a period when COVID-19 is a healthcare concern.
Okay. So have motion second on the amendment offered as a verbal. Any questions or comments on that amendment? If none, we will consider that, and we will.
The drafting code is 016447.
Okay, and any questions or comments on the amendment? If none, we'll be adding that amendment to the bill. All those in favor say aye.
Aye.
So we're back on the bill as amended with both amendments. You're recognized, Dr. Terry. Yeah.
At the end.
Do we need a motion second?
No, at the end.
What we'll do is the technical amendment will roll into the initial amendment. So we'll just have one number on the amendment, correct? Any objections to that? If not, we will consider the bill as amended, rolling the amendments together. Dr. Terry, you're recognized.
I renew my motion.
We have a question asked before we get to that. Representative Hakeem, you're recognized.
Thank you, Mr. Chairman, and the sponsors, the committee, and legal have striven to work with me in regards to a couple of questions I have on behalf of constituents. And so it may be necessary to go out of session.
I'm sorry, I missed that, sir.
Okay. I have a couple of questions. I think it would be attorney needs to answer.
If no objections, we will go out of session and allow our attorneys to speak.
Okay. Okay. If I may.
Yes, sir, you're
Okay.
recognized.
All right. A couple of questions. One that was posed to me is that if a family member, well, as an example, there was a family member that was in the hospital for 3 weeks with COVID. They were not permitted to go into, to visit that family member, and they died while they were in the hospital. And what is the posture of this bill in regards to family members' ability to visit their loved one in the hospital, whether it's COVID or non-COVID? We're saying ICU.
Mr. Bajul, you're recognized.
Rajul Bajoy, Office of Legal Services. So under Section 2, Subdivision B3, a hospital shall not restrict a patient during a period when COVID-19 is a healthcare concern from having at least one patient representative as a visitor. Now, patient representative is a person chosen by the hospital patient, and that can be a family member or another individual. In regards to ICUs, subdivision B4 in section 2 does permit a hospital from to place limitations on the frequency and duration of visitation in areas such as ICUs that necessitate a higher level of safety protocols.
If I may.
Representative Hakeem, you're recognized. You had a second question.
Yes, sir. Does this mean that family members of persons who have COVID, are hospitalized, have the same rights as other families who have members in ICU without COVID? Do they have the same rights, or the same rights as staff, or how does that play out?
Mr. Bajoy.
So under the bill, it doesn't matter what the patient is in the hospital for. It's just that whenever there's a period when COVID-19 is a healthcare concern, for any patient, a hospital must permit the patient to have a patient representative as a visitor, so long as the patient representative agrees to follow all safety protocols established by the hospital. And those protocols can be no more restrictive than the protocols applicable to staff. So it has to be, at most, it can only be to the same level as what staff have to deal with.
Satisfactory, sir.
Yes, sir. Thank you, Mr. Chairman. Thank you, legal. Thank you, committee.
Okay, we also have a request from Chairman Byrd. You're recognized. Do you need to ask something of the legal staff, or? Okay, go ahead. You can ask Mr. Bajoy.
Thank you, Mr. Chairman. On subsection B on 4, so if a hospital, if you're in ICU or an isolation unit, they can tell the patient that you can only have one visitor one time a week for 15 minutes. Will the hospital be able to do that?
Mr. Bajoy.
I believe that's correct. In subsection or subdivision 4, it does say it has to be in an area of the hospital that necessitates a higher level of safety protocols. So the hospital may need to make some showing to justify why it's necessary to have that higher level.
Well, most of your COVID patients, especially the severe, are more likely going to be in isolation unit are in intensive care. So they may say once every other week or once, a month, and that's not going to be too good for the patient at all. If
Is
they've
that
got that much authority.
is that a question, sir?
Yes.
Mr. Bejoy, do you have an answer for that?
I'm sorry, could you restate the question? I
Well,
apologize.
Yes, Chairman Byrd.
Yeah, if they want to say, then, I mean, like I said, I guess it's really a comment, but most of you COVID patients are severe enough that they're going to be in isolation or ICU. So that's really going to mean that the hospital is going to be able to tell that patient when and how long then they can have a visitor, which, like I say, it could be just once a week for 10 minutes.
I realize Mr. Bejoy has a house doc hat, but I don't know if he can answer that or not. Do you have an answer for that, sir?
All I can say is that under subdivision 4, it does permit a hospital to place limitations on both frequency and duration of visitation. So that could be 1 week or once per day. But it's not specified how far they can limit the frequency and duration of visitation.
Chairman Byrd.
Well, the only thing, like I say, I did have one of my best friends had COVID, and his family didn't get to see him because they wouldn't let him come in. So to me, this is not really helping that much if you've got COVID and it's severe and you're in isolation. Thank you.
Yes, sir. Any further response, Mr. Bejoy? If not, we'll go to the speaker, to the sponsor. No objections. We'll go back in session and recognize the sponsor, Dr. Terry.
Oh, well, thank you. And maybe this may be a statement for legal, but when I was speaking with the speaker staff and the hospital association on this, the language that necessitate a higher level of safety protocols, I asked that specific question, and the intent is that they would have to show what those specific necessary safety protocols were. So in the event that there wasn't a necessary protocol to prevent somebody coming and visiting somebody, if they couldn't show that it was necessary, then that patient could have that visitor.
Further comments or questions of the sponsor? If none, we will be voting. No objections. We'll be voting to send this bill to Calendar and Rules. All those in favor say aye.
Aye.
Any opposition? So approved. While I've got the mallet here, I'll hand it back.
All right, thank you. All right, I believe do we need to reconsider action? No. Okay. I need to, on item number 13, we need to clean up item number 13. I inadvertently sent that to skipped a step or two. So that needs to go to finance full finance. Okay. So without objection, item number 13, House Bill 2500, will go to finance. All right. Seeing no further business before us today, we are adjourned on time.